Hello, I'm Logan Harney, and I'm going to talk today about TBI with infants and with toddlers. First, what is TBI? TBI stands for traumatic brain injury, right there. It is caused by external physical force, and it results in total or partial functioning or psychological deficiency. What TBI is not. It is not a degenerative um, disease to the brain. That means the brain does not deteriorate. The mind does not deteriorate in any way. And it is not congenital, meaning it is not because of the conditions at birth or the environment that the infant was born in. It is specifically the injuries caused to the brain after birth. So then what is TBI caused by? It is caused by any injury to the head, whether that is the head hitting an object or an object hitting the head. It is when even an object punctures through the skull and touches the brain tissue. But it does not mean that an object has to touch the brain tissue. Sometimes it could be the brain tissue going back and forth within the mind, creating a ping pong effect, thus damaging the brain tissue from the inside. It is caused by domestic violence, car wrecks, falls, and all sorts of other instances. How can it then be prevented for toddlers and infants? One thing is proper seatbelt safety. It is so important that toddlers are in the right kind of seat in the car and that they're buckled up properly. And you do not want them in the front seat, and they gotta be in the right kind of car seat. Another thing would be gates at the top of stairs. This is important because, like I said, falls, those are a big issue, creating traumatic brain injuries. And so to prevent that would include hindering the young child from falling down any flight of stairs. Even if it's a small flight of stairs, really be cautious. It's important to hide dangerous objects and to keep heavy objects away from the edges of tables. You don't want to accidentally knock off an object and it hit the child's head. You don't want that kid to grab up on the table and the table falls back and the object hits the kid. That is extremely dangerous. Another thing would be making sure the TVs in the household are secure. New York Times did a study showing how many infants and toddlers have not only been injured and hurt by fallen TVs, but have unfortunately been killed by fallen TVs. And the statistics are quite alarming, as there's many instances where infants and toddlers have been hit by these things. So anything that's on an unstable setting, like a desk or a bookshelf or whatever, if that falls because it's not stable and it hits the kid, it can be traumatic. It can be horrible. It could even kill the child. And not only TVs, but like I said, bookcases. That kid, like most kids, they like climbing around on things, and they're going to climb around on your bookcases maybe. And those bookcases could start falling back as the child's climbing around on it and pretty much smush the kid, which is frightening. And another thing to prevent is just doing your best and doing your part in reporting domestic abuse. If you hear it in your neighbor's house or whatever it is, if your student comes to the preschool or whatever with bruises, it needs to be reported. It needs to be looked into for the sake of the child. It is important. So then what are some symptoms of TBI? According to the American Association of Neurological Surgeons, the symptoms of TBI can include vomiting and headaches, confusion, perhaps coma, loss of consciousness, dilated pupils, vision changes such as blurred vision or seeing double or unable to tolerate bright light, loss of eye movement, or even blindness. It can include dizziness and balance concerns, the swelling of the eyes as well, breathing problems, slow pulse, slow breathing rate with an increase in blood pressure, ringing in the ears, changes in hearing, cognitive difficulties, inappropriate emotional responses, speech difficulties such as slurred speech or inability to understand or articulate words, difficulty swallowing, body numbness or tingling, droopy eyelid or facial weakness, loss of bowel control or bladder control. And some of these things, they don't necessarily seem like they're connected directly to a brain injury. Like some of them, like eyesight or hearing, that seems to be very much so related to being hit in the head. But there's other things, such as the loss of bowel control and bladder control, and slow breathing rate with an increase in blood pressure. These things that don't necessarily seem connected, but they actually are connected. It's important that we look out for these symptoms with these students. So how severe then can TBI be? It can be anywhere from mild, moderate, all the way to severe. Mild tends to be the more short-term injuries. A kid getting hit in the head with a ball and then falls on the ground for a bit and then shortly resumes playing and he has none of those symptoms. It can be moderate, maybe a few days to a week or 2 weeks, much longer of a injury. And it can also be severe, where it's a lifelong injury that the head receives. It can result in comas and unconsciousness, perhaps even death. So it really just depends how much the brain tissue is affected from the hit to the head or the movement of the head. Some statistics on TBI. This is just TBI in general with not only toddlers but all ages. 2.87 million cases in the USA in 2014. 837 of those were children, and then 13 million currently have a disability due to TBI in the USA. 288,000 hospitalized for TBI per year. And children under 14, so this is closer to toddlers, not exactly toddlers yet, but children under 14, there's over 2,500 deaths and over 23,000 hospitalizations. So that's just to show how intense and real of a threat TBI is. Some statistics then for toddlers is for 0 to 4-year-olds. There is 1,591 TBI cases per 100,000. It's not extremely common, but it's still pretty common. If you think about a preschool with 100 kids, you'll have 1 to 2 kids with TBI, with traumatic brain injuries. So it's important to realize that you'll probably come across this as teachers. What is the most common thing to occur which results in a traumatic brain injury? Falls are the big one. Falling downstairs, falling out of a play set, or whatever it might be, a swing set, anything. Motor vehicle accidents, again, I can't stress enough how important it is that children are buckled up properly. Accidentally being struck on the head, 12.5%. And then also, unfortunately, 8.3% is because of more purposeful things with assault and child abuse. So then, is TBI treatable with these toddlers? Some say it is, some say it isn't. The only thing that is treatable with TBI is just a lot of rehab. As you can see there's not much you can do at all really to reverse the injuries done to the brain. But you can prevent further injuries from occurring. So that's what we need to be aware of with these students in developing their basic well-being. Here's just an example of what a traumatic brain injury looks like with an x-ray. So you can see there's a crack that goes along the head right there. And then here we have a video that just shows what happens when an infant receives an injury. So this kind of unpacks what's going on in the mind. This injury is one that didn't puncture through the skull, but it was probably an internal injury, such as the kid hitting the head or being jolted, perhaps even shaken. And as we see here from the CT scan, the CAT scan, in other words, there's the brain, and then there's the injury. There's the brain damage. It's on the inward part of the brain. It's a very dangerous and very serious thing. So some of the specific impairments that occur because of TBI include cognition impairments. They don't process things well or think through things very well. Language impairments, difficulty learning language. Memory impairments, short-term memory, long-term memory, forgetting names, forgetting events, forgetting days of the week, etc. Problem-solving impairments, difficulty solving simple, easy tasks. Sensory impairments, perceptual impairments, motor ability impairments like holding a pencil or turning a page, physiosocial behavior, interacting with peers, physical functions, like I said, the bowel movements or the loss of bladder control, information processing, and then speech, stuttering, or whatever other kind of impairment. So for future prevention, we've already talked about this a little bit, but in the classroom, helmets and pillows, and if they have a seizure, doing your best to guard their head, making sure that their head does not receive any further damage. So teaching students with TBI, Friend and Bursuk tell us no single strategy is effective with working with students with TBI because their injuries and the resulting impact on learning vary widely, and because their needs change over time. You should ask special educators and other professionals how best to work with a student with TBI. And if you notice changes in the student, you should alert those professionals so that an appropriate adjustment can be made in the student's educational service. So it's important that you work together with the special education teachers so that the student gets the best experience that they can get. So some strategies then for maintaining the student's attention would be color cues. That is color coding things and telling them when this color shows up, that means you do this. When this color shows up, you do that, etc. Smaller teaching segments, you don't want to go on and on and on and on and on. You want to make sure you keep things short and simple and to the point. You want small amounts of information per page. With toddlers and infants, maybe they're doing a coloring book. You want to print out very simple images for them to color. You don't want those very complex ones. That could be overwhelming and very difficult for them to do and even enjoy. A lot of them will need a quiet workspace, a place where they can really focus on thinking. They need an empty workspace with minimal distractions and cue words to keep reminding them to stay focused, such as remember to draw, remember, listen, etc. Strategies for their memory would be repetition or relating new information to previously known information. Strategies for organization would be clear procedures, perhaps even with pictures and color-coded materials. Strategies for information processing. You got to give them time. You got to be patient with them. Don't pressure them saying you need to learn this now, but be patient and slow with the pace of the instruction that you're giving them. And even have them repeat what to do next. Like if they need to know what to do when to go to the bathroom, you say, so what are we going to do when we need to go to the bathroom? Are we going to raise our hands? So just kind of scaffolding their informational processing. And with scaffolding with the student, especially with the motor skills, sometimes you'll need to write for them and draw for them on occasion. And just so that they can get their thinking going. And it's going to be you writing, but it's going to be them thinking, and that is important. And giving them tools to help them hold their pens and pencils better. We also have, as always, the social difficulties, unfortunately. Friend tells us students with disabilities are more likely than other students to be bullied. Those with autism and those with orthopedic impairments are most likely to experience repeated bullying. My presentation is about to lose time, go on to the next video, and I will